Hi, welcome to my website. My name is Dr. Nick Tedder, and I'm an Upper Cervical Chiropractor. We specialize in the brainstem and post-concussive treatment. And that's what I want to talk to you guys today on this video. If you're on this website looking, that means you or your child or somebody that you know has had some sort of trouble after their concussion. And I do want to make it very, very clear, I'm not a concussion. I don't diagnose concussions. The medical doctors, the athletic trainers, there's a lot more specialists out there that have been, they're great at diagnosing. So once you get a diagnosis, where the trouble starts is in the treatment. So right now with concussions, we have everybody's a specialist and don't really quite know what to do. So the main answer right now is either medications, time, rest, and when everything seems to resolve, then we're okay. But that's not true, because if you think about it, the doctors always tell you or your child or your friends that we don't want a second concussion because that could really cause some serious damage. And the reason that is because they never really fixed the damage before. So in our office, what we do is we treat post-concussive problems. We get phenomenal results with it, and I'm going to explain to you why in just a minute, and then I'm going to explain to you what we do to find out if we can help. But the main reason we can help with post-concussive problems is because pretty much 100% of people who've had concussions, they have a slight misalignment of the top bone in their neck. They call that the atlas. The misalignment is called a subluxation. So here is the top bone in the neck. That bone literally sits up under your head right here. And the problem with concussions is if I flip this bone forward, there's a hole. And in that hole is your brainstem. This is where all the problems occur, because if you have a trauma, whether it's a football injury or a sports injury or a whiplash from a car wreck or you fall off a ladder, if you have a concussion, this bone is very light and will start to move. It literally pushes out of position and gets stuck in an abnormal position, and at that point in time it squeezes down on that brainstem. When it squeezes down on that brainstem inside your neck, rest won't help that, drugs won't help that, therapies won't help that, nothing will help that until that bone is out of alignment. Until that bone is put in alignment. So if you've had a concussion and you have this misalignment and your brainstem is shut down, your body over time will always win with sickness and disease. You'll get headaches, you'll get depression, you'll get dizziness and vertigo, you'll get neck pain, you'll get anger issues, you'll get brain disorders, you'll get traumatic brain injuries. There's a whole host of problems that you'll get, all because this bone got out of alignment and nobody corrected it, detected it, and fixed it for you. In our office, this is what we specialize in. So if you've had a concussion and you've tried all kinds of treatments and they've either not worked or they really help a little bit, you might, more than likely, if you statistically speaking, have a misalignment in the upper neck, shutting down the brainstem, and you have an upper cervical problem. I'd really like to give you a story of a patient to just kind of put it in perspective for you. We had a young man that's probably 13 years old. I'm giving you roundabout numbers because I'm not allowed to give you names, numbers, and ages. Let's say around 13 years old. The point of the story being is this young man came to us as a football player. He had a concussion 4 years ago. 4 years ago, 2 weeks after the concussion, he began to have migraine headaches. Those migraine headaches over that 4 years, you got to remember, he's been under some of the best neurological care, best neurologists. He's been an athletic trainer. He's had everything under the sun, from drugs to therapies, you name it. This little 13-year-old boy at this point in time has had all that. But after 4 years of post-concussion, this kid is getting worse and worse and worse and worse and worse and worse and worse. Mom brings him to us. We got an MRI. Well, I didn't do the MRI. We had an MRI done. MRI showed that there was neurological damage in the brainstem, what we call ectopia. That is a big fancy word that the brain came down into the neck from the concussion. We also detect that and correct that. The ectopia led them into my office, and we did that. We took very specific films like we mentioned on the video above. We did a very specific test. This isn't his, but we did a very specific test to find out brainstem disorder. When we find that on that child and we showed the parents what the problem was, the beautiful thing is we began to correct that problem, and over a series of corrective care, that child began to get his life back. He began to have more focus at school. He began to smile more. He began to have headaches that go away. Why? Because all he had from that concussion was a misalignment that was squeezing on the brainstem, and then we were able to get his life back for him. So I would encourage you, if you're watching this video, to give our office a call. We have an office in Hamilton Mill, which is North Georgia, and we also have one in Sandy Springs. We would love to sit down with you and chat about what's going on. See if it's something that we can help with. If we all parties feel like we can help you, then what we do is we're going to recommend to you an upper cervical evaluation. And in that evaluation, what you'll get is, the first thing you get is what we call a thermal scan, thermography. This is a neat instrument that allows us to detect whether there's an injury there or not upper cervically without having to do anything invasive. We literally run the scanner up the neck and we'll find a few things. In a normal person, we want this picture over here, which is greens. You want greens all the way down the spine, and that means that this is in alignment. It means the brainstem's healthy, and the concussive problems you have would not be able to be fixed by us. However, if we run a scan on you and you have something like this, where we have a multitude of different colors, and I'm not going to go into the colors today, but the colors represent degrees of damage. If you have that pattern, then we know we have an upper cervical misalignment shutting down the brainstem, causing post-concussive syndrome. And that's what you got. From there, if we find that, what we'll end up doing is we'll do a series of x-rays on you. If you look right here, you'll see an x-ray, but we do three-dimensional upper cervical films. Films that you couldn't get anywhere else. A hospital won't do them, a medical doctor won't do them, a chiropractor can't do them. But there are three-dimensional x-rays where we actually literally measure vectors, angles, and create mathematic systems to reposition this bone very gently without twisting, cracking, racking, and popping. And then we post-check and scan it to make sure it's corrected. And then we watch you or your child or your loved one heal. It's that simple, and that's what we do. So if you're watching this, I would encourage you to either call the office, which there should be a number down there somewhere on the website, and or put your name in the box so we can have one of my staff, Sheila, Renee, or Miss Judy, give you a call, and we'll figure out a time that we can have the doctor sit down with you and discuss your problem, see if we can help you. Again, my name is Dr. Nick Tedder. We do specialize in post-concussive syndrome, and be quite frankly, we get great results. And so I would love to be able to check you or your family members out and see if we can be the answer so we don't have years of suffering or an athlete that can no longer play sports and ruin a scholarship or a career. Let us help you. I look forward to meeting you, and give us a call. Talk to you soon.